would say probably my biggest accomplishment and what I'm probably known for in the mental health world or in the world of psychology is my work at Centennial Center for Mental Health and Brain Injury. I was able to, obviously with an amazing team and amazing management, turn a rehab unit that was mostly, it kind of turned into a housing unit into an active rehabilitation unit. And so for folks that had been hospitalized anywhere from 5 to 15, 19 years had an opportunity to develop skills and receive support so that they could live independently outside of hospital.
And I work with kids and families who have a trauma history and who have experienced some relationship struggles. And so part of my biggest love is to work with teachers in schools because I think they can change the world. So when I was in school, it was a teacher actually who made me feel like everything was going to be okay at times when it didn't feel like it was. And so I remember thinking at that time, in fact I said to my dad, that's what I want to do. I'm not sure what that means, but I want to make people feel the way that that teacher made me feel. And so I think now as a mom and as a wife and as a daughter, I think there's so many things that I just wish my babies felt every single day. And that is they can walk down our streets and feel like people look them in the eye and are excited to see them. And they walk into their classrooms and at least 2 teachers that day would say, I'm glad you're here.
We have an independent dental hygiene clinic as well as a spa, a medical spa, so we've combined the two. I think that I do what I do because we have an opportunity to influence people in so many different ways, through healthcare and then through the more natural healing of the spa, so it's just a very healthy place to be. Typically dental offices are very stress related, and by combining the spa in the same building, they run separately, but the atmosphere makes it a lot more relaxing.
It was nominated in the health category, primarily in the spirituality component. I guess my basic premise in life is that everybody is gifted and has talents, and it's how you use them that's going to benefit not only you, but your community. So when we moved to Olds, my husband and I decided that faith and family were our priorities. Lots of different involvements in our church. I love to share my faith, so I would develop programs to work with children and with adults as well.
Incredibly important. For me, health and wellness is mind, body, and spirit, not just the body. And of course, we're a spin studio. We also do yoga, but people automatically think about the physical side. And we really try to give the whole package to people. So some people come for the sweat, some people come for the community. Sometimes it's something a teacher said that makes them feel good, and we just want them to have a safe, happy place to come to.
Being a chiropractor for the past 26 years, it's been awesome to just have my patients and just the satisfaction of knowing that I'm helping people every day. Yeah, it feels really good. Because I like to help people, yeah, and take care of people and try to make them to be the best they can be. It's very important because people need to be well, otherwise we don't function well in our society. Knowing people are well and the thanks that I get from moms and the kids even when they're feeling better or when they actually have that moment where they're like, wow, I feel better, and yeah, that's the reward.
I was recognized for Holding Hands Doulas. I get to be at someone's most special moment of their life, so I don't take that for granted. It's all about building relationships because my clients have to trust me that I have their best interest at heart. I think for me, honestly, our world is just so full of bad things. And it doesn't matter how many hours I'm at a birth. When I leave, I feel like there's a good in the world. It's just a moment of happiness.
I have a daughter named Hope, and the foundation is called Hope for MVC Kids Society. So she has a chronic health condition, and we recognised a need in the community for adaptive equipment for children for home and school following her journey. So obviously I have my own personal approach of why I do what I do, but I also worked with children with special needs, and I was surrounded by families with medically fragile children and things like that. So I noticed a huge gap in the community. There's actually a huge gap for this across Canada. There's no other group like us across Canada. So we thought, me and my co-founder, we thought, well, we can either complain or we can actually do something to fill that gap.